This is Katie, Executive Director here at Seasons at Apple Valley. Just checking in here for March Resident Council. We got a few different things on the agenda today. Before I get into our normal routine of updates and different things, I have a guest with us today. Melissa from Genevieve is here to talk a little bit about Genevieve and our partnership with them and how they can better support you as residents. So first up, I will hand it over to Melissa, and then after that, we'll jump into our normal business as usual. So here is Melissa.
Excellent. All right, thank you. I'll go ahead and put this here. All right, excellent. Thanks everyone for having me. I am really excited for the opportunity to do this virtually. It's a really interesting time to troubleshoot different ways to be connected. My name is Melissa Markford. I work with Genevieve. I've been with Genevieve for about 2.5 years as Director of Operations, but I have 13 years of experience with the VA prior to coming to Genevieve, and the two companies or the two organizations really are very different, night and day, but we are here today to talk about what having Genevieve in your building means to you. And first of all, I want to start by saying that it's been such an interesting time and an exciting prospect to work with your leadership and the Ecumen organization to offer an additional choice to you here on site. And I'm here to just talk a little bit more about our history, but then also explain what the benefits of choosing a Genevieve team would mean to you. So today I brought these handy dandy little folders that have just a ton of information about our company, and it walks you through how to enroll in our primary care services. A big thing about Genevieve is Genevieve was started in 2003 by a doctor, a nurse practitioner, and an RN. They started off with just a couple of patients. So in 2003, they started off as a subgroup of North Clinic, which is it's primarily located in the North Metro as a primary care practice. And it had a geriatric emphasis of taking care of older adults in nursing homes, assisted living, and out in the community. And the company has gone over the years to grow, now that we're in our, I believe it's the 18th year, to grow exponentially. In 2011, Genevieve became a joint venture, and it was half owned by Allina Health, which is one of the major health systems here in Minnesota, and also half owned by that home organization, North Clinic. And from there, it continued to grow in census and the presence that it had in the community in different senior living communities, and is now an organization of it went from that one doctor, one nurse practitioner, and the one nurse to being a company of 183 employees, 63 nurse practitioners and physicians, I believe about 55 registered nurses, and about 4,500 primary care patients in the Twin Cities. We also do care management services in the community for members in the community who need care management services, so that's our other umbrella of our company. But the really interesting thing about Genevieve is that we work in tandem with the facility and the family and the resident to make sure that everybody is educated on the choices that are taking place throughout the healthcare journey. For instance, I'm talking really fast, so I'm out of breath a little bit. We have the family conference, which is really the cornerstone of our practice, in which we meet with the family, we meet with the resident, and set the goals for what the healthcare is going to look like. With Genevieve, you get access to a physician, which on site here it's Dr. Turbis. Sherry Holk is the nurse practitioner, and they're both very active participants of the care. And if you elect to have a Genevieve team via the ISNP, which is just a vehicle to get our team, but not necessary, you get a clinical nurse coordinator. So There's a lot of information that I could share with you, but just really excited to be here. It's a really interesting prospect to be offered as a choice. Make sure that you stop down and ask for this folder here. It's got a ton of information, and you can't see me smiling, but there's a big smile under the mask. So, anything I should point out?
Maybe talk about like that there's how they can communicate with, like right now Bluestone has like a portal, so how would they communicate?
Excellent question. So, to reiterate what the question was, a big form of communication for us is we have a 7-day-a-week triage department where in lieu of logging into a portal, which is highly sought after, you have access to a registered nurse and your provider to be able to speak to them 7 days a week from the hours of 7 a.m. to 5 p.m. So with any concerns, there's coordination efforts that address any questions that you may have, any questions that your family may have as well, and everybody is always accessible to you. In addition to that, we have on-call providers on 24 hours, 7 days a week. So should an emergency arise, we would be able to look in the chart and make sure that there's a concerted and coordinated dive into your medical record to make sure that everything is being examined. Now, we are weighing a couple of options for online portal because it's so highly sought after, so more to come on that. Anything else?
No, I think that's
Okay, excellent. Thank you so much.
Yeah, thank you.
Yep, we'll leave this here for you.
Perfect. All right. Well, thank you to Melissa for stopping in and talking a little bit more about Genevieve, their physicians group, and how they can help benefit you as residents here. So, like she mentioned, if you are interested in grabbing an enrollment packet or looking at more information about them, feel free to stop down at the front desk and we can get those packets to you. In terms of qualifications to get enrolled with them, independent living residents would not qualify. However, anyone in assisted living would. So if you receive any services from us, whether it is dress and groom, med management, safety checks, whatever it is, and you're on assisted living services, you can get enrolled with Genevieve. You don't, differently than what Bluestone does. Bluestone, our physicians group that comes in right now, you have to be on medication management in order to get enrolled with them. That isn't how Genevieve is for their enrollment. So you don't have to be on any one particular service, but you do have to be on a service in order to get it. So like I said, if you have any more questions about that, Brianna Sather, the RN clinical director, could help answer those, or you can always stop down the front desk and ask for a packet of information and look that over, and we can try to answer as many questions as possible. So we are just excited to have another option here in addition to Bluestone, our physicians group, Genevieve Physicians Group as well. We'll be able to provide some support here too. So excited for that opportunity. Now just to dive into our normal business census, memory care, we have 4 open right now. 2 of them are reserved. Assisted living, we have 6 open and 1 reserved. Residents that are no longer at Seasons, Lee Knutson passed away, Barb Frank passed away, Mary Rundell passed away, Eddie Miller passed away, and Ray Smythe moved out. And then as far as staffing updates go, we are still recruiting for resident assistants. We did hire 3 this month. We are still recruiting for a full-time maintenance technician. We've been actively conducting interviews, hoping to extend an offer here this week. So hopefully we'll have someone in that role soon. We have hired a part-time receptionist. You may have seen her starting to train at the front desk. Her name is Katie. She will be working Monday, Wednesday, and Friday evenings. So we are very excited to have her on board. If you haven't met her yet, please stop down and say hello to her as she'll be training. She'll be wrapping up her training in the next few weeks here. And then we are still recruiting for a part-time driver, activity assistant, and then also a dishwasher position. March resident of the month is Lorraine Cook. So congratulations to Lorraine. If you want to know more about her, pop on to that channel 20 in your TV and you can see more information about her. Vaccine. So I just wanted to thank everybody for getting the vaccine. I know, we now that we have had that second vaccine dose, you're considered fully vaccinated. So that is very exciting, such an exciting time. And we're still working on getting essential caregivers vaccinated and hoping to do that soon. We were supposed to have them vaccinated during our second clinic. However, with the weather in the south, those vaccines didn't get distributed to us or transported to us on time. So we weren't able to get them, but they're still on our radar. We still plan on getting them vaccinated. It's just we're trying to work with the pharmacy and figure out when, based off of when they actually received the shipment. As of today, they still have not received the shipment of those vaccines, so it's been quite delayed. I will continue to send out more information to families via my weekly updates and email groups about that. If you know of a loved one that isn't on that list that wants to be, feel free to have them reach out to me, or you can stop down at the front desk and provide me with their email address and I can get them added. I've had a lot of questions recently too on, when is the guidance going to change? Has the guidance changed for what we do now, now that we're fully vaccinated? And I know I mentioned this last month, and guidance continues as is. So really, now that we're vaccinated, still at this point, nothing changes. So we need to make sure that you are following the guidelines that we have set in place and that the Minnesota Department of Health has set in place. On my calls with the Minnesota Department of Health, they have mentioned that they're reviewing the guidance to figure out what that looks like now that people are vaccinated, but they have not rolled out any changes yet. So, I just want y'all to stay tuned. I know once those things do change, I will be sure to let you know, because I know you're all very eager, as are we, but we need to make sure that we're following those guidelines closely. So what we need to continue to do, we need to continue to wear our mask, wash your hands frequently, stay at least 6 feet away from others, cover your coughs and sneezes, continue to disinfect, leave the community for essential reasons only, so like doctor visits, dental visits, essential shopping, things like that. Gathering with family is not recommended, and you will need to still quarantine for 14 days if you do gather with family. So those are all still the guidelines. So I know we've been working on those guidelines for a long time now. We've been running with those, but like I said, since the guidance hasn't changed through the Minnesota Department of Health yet, we have to continue following that guidance. So the major concern that the Minnesota Department of Health has is that not everyone has been vaccinated yet. So, for example, family, if you go gather with family, maybe your daughter is vaccinated, but your granddaughter or grandson aren't. So, they could be bringing it to you. Even though you're vaccinated, you could still potentially pick up the virus. So at this point, there's still just a lot of unknown and still a lot of vaccines that need to be distributed yet. So until that happens, I don't really see the guidelines changing, but they will be changing soon. We just want you to just be patient and follow these things still. So On an exciting note though, we have been COVID-free now for over 14 days, almost a month, which is very exciting and a testament to everything that our staff is doing, everything that you are doing as residents, everything those essential caregivers are doing when they're coming in to ensure safety, which is great news. So because of that, we've been able to do our indoor, in-person visits. So for those of you that don't know, you can have a family or a friend, up to 2 people come into the community, into your apartment. They have to make an appointment, and they can stay up to 1 hour during that appointment. So all appointments can be made on our website at seasonsapplevalley.org. Right on the main page, it says Stay Connected. And they can just scroll down, click on that, and then all the calendars pull up of where they can make their visits. So, so if you do have any family or friends that you'd love to come see you, I encourage them to go onto our website and make an appointment for an in-person visit. We will continue to do those in-person visits as long as we're COVID-free. So we have to be COVID-free in order to do those. So let's continue to work hard on wearing our masks, keeping our social distance, not gathering with family, and doing all those things we need to in order to make sure that we do stay COVID-free, so all the residents in our building can enjoy those family visits, the indoor visits here. If you do have any questions on that or on the indoor visits, feel free to let me know, give me a call, ask the front desk. We'd be more than happy to help with that. I just wanted to update on dining. In the suggestion box, there was some recommendations for some sugar-free items. We will be offering more sugar-free items in the dining room. Right now we have syrup, but we will be having like Jell-O, ice cream, other dessert options as needed. So as you're at the dining table, ordering your meal, feel free to ask your server about more information about sugar-free items if that's what you're interested in. We are working on getting more of those items, and as there's more of an interest, we'll figure out what people are wanting and go from there. And then we do have an iPad available for checkout that has several different activities on it. So like adult coloring, videos, trivia, games, exercise, and more. So if you are interested in checking this out, just stop by Stephanie's office and she can help you with that. If you do check it out, we'll have you keep it for 24 hours and then return it after that. So you have 24 hours to play around with it and check out what's available for some fun different opportunities there. Beginning March 8th, we will no longer be handing out bingo bucks. So for those bingo goers, just want to make sure that you're aware of that. As of March 8th, we will not be handing out bingo bucks. So to be COVID friendly, we've had to adjust a lot of our policies and procedures over the last year now. And this is just one more thing we're having to look at for the future moving forward. We have decided that anyone that wins bingo during a bingo session will be entered into a drawing where 2 people will win a $5 gift card to either the Salon, Cub, Target. Everyone that wins in that session will receive a small item, but only 2 people will win the gift cards. And those gift cards will be immediate. We'll get in the drawing, we'll hand them out right at that bingo session. So no more holding on to those bingo bucks, doing the transactions later, all of those things. So we feel this will streamline things a little bit easier and it will be a lot more COVID friendly. And then I also wanted to mention that beginning at some point this month, we will be having, with our addition to the front desk, and Katie working until on Monday, Wednesday, Fridays now, we will be extending the front desk hours back to what they were, staying open until 8 o'clock. So that date on when we do that is still to be determined based off of Katie's training schedule, but it'll happen sometime this month in March. So I just wanted to make you all aware that that we will be having someone at the front desk a little bit later than we normally do, which will be good because we will be able to offer visits later in the evening, and then, you know, if you have obviously any questions, you'll have a go-to person at the front desk then later as well. So stay tuned. I will update you on when that date will change, but we're looking forward to be opening a little bit longer than in the evening. And then just a reminder too about Genevieve again. Genevieve is a physicians group similar to Bluestone. However, you don't have to be on medication management to be on Genevieve, but you do have to be on any service with us. So, and you can't be independent living, you have to be on assisted living. So, that's it for me today. If you do have any questions, comments, concerns, feel free to stop down, give me a call, shoot me an email. But look forward to the month ahead here as we approach March, and looking forward to us tackling more of the COVID and the changes that will be coming with that. So stay healthy, everyone, and we'll see you soon.